continues to build her team and to think hard about the organization of the agency as one that is totally service-driven and integrated with the work of the field. And I'm pleased to say that many of you know that we spent some time on the Commissioner's evaluation, a very positive and supportive one, that also now we will revisit in June to bring it into alignment with the fiscal year. The Commissioner will walk us through a lot of tremendous progress, her own goals and her thinking as we look ahead. And so before June, we have today's meeting, which is a chance to sort of tie up some loose ends, get some updates on some key areas, but also start some discussion about some really important work and opportunities for policymaking that are on the horizon. So pleasure to see you all here today and look forward to this meeting together, and especially to the next couple of months, which will prove to be very exciting, I think, for the field and for the country. Commissioner, welcome everybody. Secretary.
Thank you, Madam Chair. And let me just share your enthusiasm or hopefulness for the moment that we're in and the fortuitous timing, although it seems odd to say that, but in terms of the synchronizing of our work on the strategy and as well as the other developments that are going on at a federal and a state level. So a lot of interesting things and important things going on, and hopefully we'll be able to take advantage of them. Just a couple of updates, sort of broadly defined here. Of course, I think we're all aware that the students in grades K through 8, elementary and secondary students or middle school students across the state are now all of them have the opportunity to attend school full time. That'll be extended to high school students starting next week. So we have sort of gotten to the point where everyone who wants to be in school 5 days a week can be in school 5 days a week, and that's obviously an important and positive development. Last week, I think it was last week, may have been the week before, the governor announced more than $70 million for summer learning initiatives, including the Step Up program for young children entering school for the first time who have been sort of mostly remote during this past year, and you'll hear more about that later. But also other initiatives, including 1-week acceleration academies, expanded district-run in-person summer schools, including enriched supports for students with special needs, and also with additional mental health services, expanded partnerships with summer camps and community-based organizations, in particular those that are offering standards-aligned educational services, a hands-on math camp for gifted and talented students, access to no-cost college courses for high school students who are currently enrolled in early college pathway programs, and college transition programs and career counseling for the class of 2021. And a variety of other things, but those were kind of the big items that were announced, again, probably about 10 days ago. More broadly, we're making great progress, as I think everyone knows, on the vaccination front. About 3/4 of all adults have now received at least one shot, including close to 90% of anyone over the age of 75. Massachusetts is number 2 among all states, number 1 among the larger states for first doses per capita, and our vaccination rate for Black and Latino residents is more than twice the national average. So obviously there's still a lot more to go. We're not at the finish line yet, but we've been making great progress. And the issue is no longer one of providing access to a scarce resource as much as it is proactively getting the vaccine to the harder to reach populations. And there are expanded supplies for regional collaboratives, mobile vaccine clinics, and distribution through a much wider network of healthcare providers and community-based organizations. So we've really sort of crossed an inflection point in the vaccine rollout where we're now trying to sort of finish the job as opposed to ramp it up. And I think everyone is very hopeful about what's to come, especially in the months ahead and as we look to summer and fall. So with that, let me turn it back to you, Madam Chair.
Great. Thanks for the update. Agree on the vaccine effort. It's great. It's especially great with the 12 and ups coming down the pike as well. It's looks like a much better landscape for academic year 21-22, that's for sure. Commissioner. turn it over to you.
Yes, thank you. Thank you, Madam Chair and Secretary, for the introductory remarks. And just wanted to echo as we delve today into updates around some of our processes we've launched and culminating some of the data and investigation we've done over the course of the year to set us on a path moving forward with the strategic plan. Excited to delve into that topic today. I will just in my introductory remarks give a couple quick updates that I think are continue to be investments that EEC is making and will continue to make throughout the summer as we look to see what the fall and the new academic year will look like for both our programs and most importantly to communities. And so we continue to have the testing sites available to all of our programs, as everyone knows and Secretary highlighted, even as vaccinations are become more are readily accessible and are being taken up by our field and our workforce. We still know that there are exposures and there are questions that that we want to make sure we're keeping operations running smoothly. And so through the summer, we will continue to have those testing sites available for our providers and families utilizing childcare. Again, we will reassess everything in the fall on a month-to-month basis as we understand what the resources may be needed in an ongoing way. In addition, we will also be continuing to support PPE for our providers through the summer to make sure that that is available and a resource to continue to be healthy and safe as we progress through recovery. So very excited for a return to somewhat normalcy in the fall, but really wanted to make sure that we continue to support our providers through the summer with the resources they need. Two other really quick things that I would like to highlight around support for our providers during, for our childcare providers during this time. We are moving back into in-person services and will continue to provide updated guidance and support, allowing for in-person visitors, parents to come in to programs, et cetera. And so we do have an updated playbook, and we'll continue to update that in the next couple of weeks with questions and concerns we're getting in based on the rapidly evolving landscape out there in terms of that recovery period. And so just to highlight to our providers that we are marching towards normalcy and will continue to update services, and not only our childcare providers, but those providers who are providing professional development, CDA reviews, NACE accreditation, lots of things that happen in person that have been on hold. We want to make sure people are still doing that safely, and so we still want to make sure that PPE is available, social distancing, ventilation, proper hygiene, hand washing, but we do know that those critical in-person services are really important for us to start to get back in for children as well. I also just want to highlight that for as school districts return to in-person learning, as the Secretary highlighted, we will for the remainder of the year continue to ensure that our providers have access to full day subsidies so that they can be available for our children that are returning to school should there be a need for in-person backup services over the course of the spring, knowing from a year with our providers that coming back to full-time in-person comes with many obstacles and hurdles to encounter on a daily basis. And so wanting to make sure that we are deploying every resource we have to support communities and children and families who may need it as everyone is grappling with the reality of this. So I will get deeper into some of the more substantive updates as we progress with the meeting, but wanted to make sure I highlighted the things we were continuing to invest in and support through the summer as we work to figure out exactly how we can best support the new normal and march towards what will, as we have all acknowledged, need to be a refined and revised system in the future. So thank you very much.
Thank you. That sounds great. Any questions or comments before we launch in? Okay. Let's move now to just the minutes from the April 13th, 2021 meeting. Did anybody have any corrections? Anything? Okay. All right. So let me make the motion that we approve the minutes from the April 13th, 2021 board meeting. Do I have a second?
Second.
Thanks, Eleonora. Okay, I'm just going to use my screen. Carolyn Kane,
Yes.
Sheila Balboni,
Yes.
Nikki Ruiz,
Yes.
Jim Pizer,
Yes.
Eleonora Viegas Reimers,
Yes.
Allison Schoenwald,
Yes.
Joni Block,
Yes.
Joan Wasser-Gish,
Yes.
Dave Cruz.
Yes.
All right, thank you. Approved. Let's turn now to our actual agenda items. We're going to start with the departmental update, and then we'll move to the strategic plan in terms of subsidies, and then we'll move to the caseload and the budget update. Thank you.
Thank you. So as Chair Lasso mentioned, we are going to look right now. Initially, the first agenda item is to update on some important initiatives that have been in progress over the spring in preparation for, if we can go back to the last slide, in preparation for the summer and in some of the larger scale initiatives that we're rolling out. So we'll talk today a little bit about the Step Up to Summer or Summer Step Up program that is targeting those entering school this fall, the young learners entering school who will have limited in-person resources to date, and really figuring how we can best support communities in leveraging the summer months. We'll talk a little bit about our state funding that has rolled out in the 2 grant processes we've been talking about over the last couple months. And then also look at that foundational component of our system with the regulations and where we are looking to update and to revise the regulatory framework in which the department functions under in order to best support the field going forward. Then we will talk, we'll delve into the strategic action plan when we talk about the family pillar, the children and families pillar. There are some initiatives we've been building to try to make sure that we are prepared to come back and look at our subsidy system and understand with all of the changes required both in the from the pandemic and also the vision we set forward over a year ago. Where that where that brings us. I want to highlight, I know we talked a few months ago about the work we were doing with 3SI, who is looking at our subsidy data over time and being able to do some analysis of that. And we have some interim reporting today that will help us set the stage for some of the deeper dive into our subsidy regulations over the next few months. And then of course, we'll talk through our budget update and look at our caseload, which I think will be seen in different light after we look at some of the trends that we've been seeing over the last few months. So I'll get right into it. So the summer step up. So as you all remember, we mentioned last time, and Secretary Pizer mentioned that this is part of the investment in summer learning that the Commonwealth is making that will really ensure that the summer months are maximized and really invested in for those the students who are returning to in-person learning in the fall and have had just returning to in-person services and getting into the routine. We've targeted these dollars specifically to focus on the early grades and the school entry period. So obviously looking at, in particular at the pre-K, K first, but we know that there are many students who have struggled up until 2nd grade. So wanting to make sure that those students who have had limited school experiences have an opportunity to get to know the routines, the teachers, the classrooms, and exposure to the academic curriculum that they may not have had exposure to in person prior. The idea of this program is really to support and enhance what districts may be planning for young learners or for the district as a whole, to target where we can bring our expertise specifically around young learners, and bringing the community partners to the table to provide those comprehensive services that families may need over the summer. We have looked at and we have engaged with both local partners, but also national experts who brought their curriculum, brought resources, brought kits and parent toolkits to help enhance the curriculum that the school district may be utilizing for the academic year, with STEM activities that can be done outdoors, the kind of parent engagement tools that we know will help parents reinforce the learning that's happening in the school day, summer school day. We've also really looked and used the dollars to make sure that those providers who may be caring for children in full day care or have had are a critical part of the transition into school can make sure that they have resources to support staff, to support materials, and to support those comprehensive services that may be more difficult for a district to be able to expand given their own structures over the course of the summer. And so with this, we are really excited about, we have 12 communities signed up so far to work with us on this, and more rolling in every day as districts understand the opportunity and understand what is available to them. I want to highlight that while the support that we are providing in partnership with the United Way is obviously a community support that bridges both the school district and the community partners and community resources that may be available. This is a grant really where the school district is asked to be in the lead. This is about school entry, and so ensuring that there is a key anchor point in what that child will experience when they do enter school in the fall is a real critical component of this. And so that is where we have been focusing our time and energy of making sure that we are aligning and supporting that that transition in this short time period we have to really try to impact as many communities and reach as many students as we possibly can.
Carolyn has her hand up, Sam, as commission.
Absolutely.
Hi, thanks, Sam. I think this might be more of a question for the secretary, but I'm seeing that this is aligned with the initiatives that he commented on at the beginning of the meeting. And I'm just wondering how workforce issues are going to be addressed, because I've heard from a number of different school districts that they're struggling with, staffing summer programs. And so I think that's really a big piece of it, is that all of these things actually are great, but if we don't have the people to staff them, then are they actually going to materialize?
No, I think, Carolyn, that's a great point. We're definitely watching it closely to get a sense for what the take up is likely to be from certainly, regular classroom teachers, but also other staff within the schools who might be able to fill these roles. So it's definitely a concern. We're watching it closely, and we may need to take some other kind of remedial steps if it turns out we don't have enough educators coming forward in order to fill the slots that are necessary to expand the capacity for children.
Yeah, I just want to say, I think it's absolutely wonderful that we're trying to use those summer months to sort of help and sort of bring kids back to where they were pre-pandemic. And, I'm all for those efforts. I know that I've heard from a number of different school districts talking about their staff are already burnt out and they're not willing to staff their summer programs, even people that have done it in previous years, particularly for extended school year. So I just think it's something that, obviously monitoring it, but being able to respond to it, because all of these services are desperately needed. But again, without the personnel, it's going to be an issue.
No, agreed. And one of the things, and this may help in this regard and may not, is one of the things we're trying to do in all of these programs is ensure that there's a balance between sort of the academic component with recreation and creative activities so that it's not all just school, sort of in a traditional sense, but in a different time.
Yep.
And that might make it a little more manageable and hopefully a little more enjoyable for the educators as well.
That's great. I mean, obviously teachers are burnt out, but so's our children.
Yep, indeed.
And Carolyn, just to emphasize, I do know that that is a huge issue in the EEC side of the community dynamic as well. I've been hearing, the frustration, the desperation that from our providers trying to recruit staff. And so our hope of being able, for this particular program, for these particular young learners, is being able to help by supporting with consultation, with community-specific consultation, help find creative strategies where maybe you're not just doing a school day and extended care, but trying to kind of braid and blend teachers' time in some creative ways that might help make it a more palatable initiative to take on for the summer for teachers and on both sides of the equation, districts and in the EEC programs who have had a really tough year, to be able to try to think about how we still are able to serve children and be able to get them the in-person, hopefully outdoor experiences during the summer without overtaxing staff and quite frankly, finding staff, because I think that's the huge issue.
Thank you both.
And I'd just like to mention, as we know, our early education staff has been working directly with children for many weeks. And I think in terms just of burnout and fairness, I think we have to pay attention to flexibility around payment and what we're thinking about for reimbursement for staff on the early education side of the equation.
I think we'll talk a little bit about that in terms of the grant updates that we're doing, because that was an initiative to target, I think, specifically that. So I will hopefully some of that, some of our strategies that are hoping to address that, we'll highlight in the next slide and be able to delve deeper into any of the questions we have.
Right.
I mean, of course, many of them actually basically worked right through, right? I mean, and the field at large, at least since July, August. So no question, this is an EEC issue as well.
Joni, did you want to ask a question?
Thank you. Thanks.
Oh, sorry, I missed that.
I think this also ties into some of the comments we made last month in introducing this program. It's exciting to see it roll out. And I'm just thinking about how this aligns with the EOE pre-K to grade 3 remote learning grant, because really a lot of it is the same initiative in terms of integrating the public school staff and community-based organizations. And I think it will be really interesting to see how communities utilize, without supplanting, some of their existing programs like extended day, summer learning, 21st century schools, as well as reinforce and enhance the CFCE ongoing initiatives to help with transitions. So I think it's a summer program, but I think we might be able to learn a lot from this.
Well, and I think from our perspective, and I'll let Secretary Pizer address the question on some of the EOE grants, but I think as you see in the last bullet point there, that is, I think, Joni, what we're hoping to learn creatively around what kind of infrastructure in an ongoing way we can enhance, we can continue to invest in, what role. Every community dynamic is so different, and the strengths of different collaborators are very unique in the community. And so trying to be able to understand some trends and themes through some more individualized support that could help us really think about where the investment needs to go over time as well. And I will just say from my perspective with the EOE and the summer grants, this is a little bit more targeted to not just community collaboration, but really in-person, so 6 weeks of in-person services over the summer. So it's there's a different deliverable in terms of the services delivered in an immediacy of the time frame than in some of the coordination grants. But to your point, well taken and well embodied, hopefully, is that this is part and parcel of a larger vision for collaboration at the community level that has pieces of investment over time in Massachusetts, and looking to see what kind of thinking and thought process we could enhance that with, through recovery from a pandemic.
Thank you.
I guess I'll just add, I think these are intended to be complementary, and that the step up is mostly around sort of school readiness. Obviously, it has some academic components to it as well, but it's really a school readiness effort. And the DESE grants, both to the districts as well as the Acceleration Academies, which is sort of a separate or related program, are more for students who have been in school and have had more sort of academic experience in person, with their teachers and with their classmates. So it's a little bit different population, targeted population. There may be some overlap, to be sure, and we'll have to keep an eye on it. I think ultimately they're complementary, and so should be supporting and reinforcing one another.
Thank you all.
It would be
Also
great if I could just suggest that we document some of the successes that develop out of this program to use as models, maybe for supporting future programming.
Absolutely. And I think we're working very closely with United Way, who is deeply embedded in the communities and has real specific targeted support to be able to call some of the trends and learnings.
Including those around coordination, which is always a really thorny issue and a missed opportunity often. So that'll be really interesting too on those grants.
Absolutely. So really excited on this, and Sheila, to your point, excited to come back and talk about some successes. Just very, I think, able to, I think many of you have reiterated to me over the course of my tenure so far, the real critical role that we can play in building those partnerships across districts and community partners, and really thinking about focusing on the children and families and the supports they need, and trying to leverage the coordination on their behalf. And so excited to try this, building on, Joni, as you referenced, building on some of the efforts and investments that EOE had made over the course of the year, and really wanting to learn and try to shape what next year might look like in terms of some of these investments. Obviously, Joni brought up the CFCEs are a critical investment that EEC makes to that coordination, but knowing that that's not sufficient to really help us build what we need through a recovery. And so really hoping to get some really solid understanding of where we can make the most impact given the resources we have. Yeah. So if there are no more questions on this, I will move over to our operational grants update. So just to ground us in exactly what this was and where we are and what we're accepting applications for, you'll remember over the last couple of months, we have been planning for the state investment in the operational dollars. It was a $25 million investment in the operational reserve that was passed in the FY21 budget. We have put that out in 2 grants, one targeted to center-based programs, one to family childcare, both really aiming at, Sheila, your question of how do we get funds to those people who have been working for the year, working in with our children in person. And so we, as I have been highlighting, our mechanisms to get money directly to the workforce are limited. And so we really wanted to make sure that we were getting operational dollars that could be prioritized in compensating our in-person staff. So you have the updates on the number of applications we've received. They did launch last week. And so we are culling through them as quickly as possible. We have some applications that have been approved, but the approval process, the application and the approval process is meant to be as streamlined and simple as possible, with the requirement that for the center-based grants, the majority of funding is accounted for in payments to staff in some way. So we provide a lot of flexibility in what that looks like, and been able to provide flexibility on a case-by-case basis when our initial flexibility hasn't really been hasn't met the needs of very specific providers. But the idea being that these dollars are given to providers to be able to address compensation challenges, bonuses, hazard pay, benefits, things like that we know our workforce needs, and there have been limited operational funds to provide. For the family child care, again, same objective, but trying to target their investments in their program so they can keep more of their salary or invest in a assistant or other types of resources that might specifically help their mental health, their well-being, but also their compensation. So we've had a great success so far in applicants applying very quickly, and we'll keep you updated on this. I will remind you that this is also a precursor for us to be able to distribute the federal dollars, which we will continue to talk about as we identify the mechanism for us to distribute those. Or to get the dollars, the appropriation, and to distribute the dollars. And so, but a couple key learnings in this I just wanted to highlight. One, understanding the complexities of how programs are investing in staff, and making sure that we are really trying to provide the flexibility that they need to do it in a way that meets their specific program model. For example, there are programs that are unionized that can't maybe make a full investment in staff, but have ways that they are compensating their staff through meals and materials and other things, versus a program that has made a commitment to increasing staff salaries and being able to target these dollars there. So just providing the range of ways that we know compensation looks like in our programs. And the second thing is working with an intermediary to help us make sure that we are responsive, that we are getting through all these applications as quickly as possible, knowing that the urgency in the field is often caught up in the bureaucracy it takes us just to pure manpower to get things out the door. We were thoughtful in being able to work with Public Consulting Group, PCG, of being able to help be responsive to our providers, answer the calls, make sure they have the FAQ, and are able to process applications much more quickly than we could at this magnitude, this level, this urgency with our own staff. And so those two things I think are learnings and helping us identify, as we move towards the distribution of federal funds, what kinds of systems we need to have in place to do that well, to do that effectively, and to make sure that we are maintaining compliance with the federal regulations as well.
Commissioner, can I ask a quick question?
Yeah.
Do you have any sense on average of how long it takes PCG from receipt of the application to a decision?
It is not a decision.
Recommendation.
Yeah, I will say it's a verification. It's very quick. Those 6 that you have here were as of Friday, and it was, I think there were 5 days. So it's very quick turnaround. They are verifying that the information is correct, that the budget meets the budgetary needs, right? That you have put the money towards staff compensation. For family child care, there's no budget necessary. There's budget necessary. There's no reporting. So we are, as much as possible, streamlined it, and it should be very quick. And then from the time from approval to the time that we expect the dollars actually to be to the provider, it's around 3 weeks. So,
Okay.
we'd love to get it as quickly as possible, but there are a few steps we have to follow. So it is a couple weeks in there, but.
No, that sounds great. Thank you. Joan.
Yeah.
Joan, go ahead.
Afternoon. So, I mean, on the one hand, PCG, I think, represents such another very good example of the ways in which the commissioner has been really ingenious in trying to harness capacity, looking broadly both within the state and nationally at expertise that can be leveraged to further the work of EEC. At the same time, I'm cognizant of the fact that some of this is the result of the fact that we don't have sufficient internal capacity to do all of the work that is being demanded of the agency. And so I hope that when there's opportunity for some pause, whether it's around strategic planning over the summer, or as we look at SUPs or further into the FY22 budget making process, that there's an opportunity to really think deeply about implications for long-term operational capacity within the agency, even as all of this incoming is rapidly problem solved, dollars are being turned out quickly, folks are able to apply. That's terrific and appropriate in the near term, but I want to make sure we don't lose sight of making sure that we have an agency that can manage this, what is hopefully a significant influx of federal funds coming, and that may be sustained over time.
Thank you. Thank you for that. And I will say, just in response to that, I think we are being very thoughtful also about what kinds of capacities we need to bring in. This is such a new function for us that it's giving us an opportunity to understand the function a little bit better. But I'm excited about the next meeting to reflect on what that means in terms of organizational investment for sustainability, and excited to be able to share that with you and with the field in June.
Just to echo Joan's comment about the commissioner and the staff at EEC getting this money out to the field. I know that they were very eager to have it and need it very desperately. And so thank you very much for that.
Absolutely. And I will say I've gotten a quick update. And so this information is as of May 3rd. So we have 90 applications approved as of today. So rapidly expanding.
Great. Well done. This is really nice to hear.
It is great. It's been great to be able to get some money out to the field, and I think was teaching us a lot for the magnitude, the tenfold money we have coming down the road. And I think the Biden plan that has been presented offer opportunities to think about what is the sustainability we would choose if given the opportunity. And I think that's part of our active thinking here too.
Mm-hmm. I like your frame on functions, which is to say, like, in the forward facing, 21st century service agency, what are those functions that should be internal, and which ones are you just better to outsource every time because it's not worth the investment internally?
Yeah.
Eleonora, are you going to jump in? Okay.
Yeah.
All right, great.
Excellent. So I will move on and give you a quick update, and we'll delve deeper into this, but I think this is more teeing up the deeper conversation I hope to have over the next hour of the regulatory review status. So if we go to the next slide, as you remember, part of the strategic plan that we knew we needed to do was to do an analysis and a revamping of our regulations to be able to really look differently at how we foundationally set a floor and the legal framework for our providers. So a couple of things, I know there's more in the appendix, but I wanted to highlight a couple key things, and then we'll delve deeper into it when we talk about the subsidy priorities towards the next half of the meeting. This in particular you have in the appendix, and I'll highlight here, of really looking at separating program standards and educator standards. Obviously very interdependent, but we've been talking about this in terms of the credential of being really having regulations that allow for support of those programs and providers that operate as a facility for out-of-home care versus the educator themselves, who may move between different providers or different types of care, or maybe even in and out of childcare to being a home visitor or into their early intervention system or a CFCE, and really wanting to reflect and acknowledge and validate the expertise that's gaining, separate from if they are existing just within one program. And so that has been a key function of our work. In that, we'll be looking at our program configuration in a way that can really honor the difference between family child care and group and school age type providers, and not trying to have one set of regulations that everyone fits into, but really understanding those, the unique asset. And I will say, for me personally, the family child care world that I think Massachusetts is incredibly unique in the regulations and the support for is being able to really make sure that our framework for them honors that unique business model and type of setting. But then also, I think really understanding, and we'll come back over the next few months on some of this, but really understanding the designation between those that are serving a broad range of ages, birth through age 12, versus those that are targeting just after school, out of school time, or just early childhood, and allowing our regulations to not try to bog down one type of provider to meet every provider's needs, and trying to categorize and simplify for providers what they can meet if they are within a certain category. That's very much in configuration and in development, but I wanted to highlight that our approach to program regulations will then be trying to honor the types and the settings of the program as well. Yeah, Carolyn.
Just a question, Sam. So EEC currently licenses special education residential schools. Is there any discussion with DESE about the appropriateness of that on the go forward? Because it really is for individuals who are, 3 to 22 and within the primary responsibility of the local school district.
Yep.
And I just I had an issue come up this week, about a residential school, and I'm thinking about it and I'm saying, oh, that would require me to reach out to EEC as well as DESE. And I was just wondering if we're under a regulatory review process.
Yeah.
Is there discussions with DESE about that issue?
Yep, and I'm realizing so that the licensing has childcare and center-based, but it also should have residential and placement. We are looking actively at those regulations, particularly our residential regulations. Our placement regulations were updated fairly recently and are fairly comprehensive, and so I'm not seeing a huge need to revisit those. But to your point, Carolyn, that the residential ones are being looked at not only in relation to DESE, but I know that DCF is doing a rebid of their contracts, which also allow programs more flexibility. And I think thus in our conversations with DCF require us to then set a more standard floor, so the flexibility doesn't fall below a certain standard. And I think as the regulatory body or the agency, we see that as our goal or our role to be able to ensure that within the flexibility needed for specific populations, we're setting a minimum standard that that ensures that that we're not, seeing exorbitant ratios or anything along those lines that would jeopardize the overall viability of a program and health and safety. And so, yes, that is part of it with Andrew Rome, who you met last time and is at the meeting, to make sure that he is digging deep into that and understanding for those unique situations, how how we can better align with our sister agencies there.
Thank you.
Yeah.
Maybe just one other comment on that. We have definitely had this conversation before. I can assure you over the last several years, really probably going back to the first few years of the administration. It's complicated, as you're well aware. You've got DESE, who is overseeing the school part of those programs. You've got EEC overseeing the residential side. You've got DCF, which is contracting for some slots that are going for children who are going into those programs, both at a residential level and at a school level. And then you've got other entities that are just group homes that don't have the school. And that, so anyway, so that the difficulty and the complexity of ensuring that there's consistency as well as simplicity it's just tough. But I'm glad you raised it, because it's worth continuing to take a look at.
Absolutely. So, and we'll look forward, I think, in full disclosure, we haven't gotten to the depths of the integration with the res ed schools yet. We're still looking at different components, but that is definitely on the list to dig into. So I wanted to just make sure that you had the conception of where we were. As I said, looking at the licensing and educator regulations, and I think today, after a lot of work on the subsidy structures like parent fees and the analysis that will help drive regulatory analysis, we will make sure that we'll be digging deep into some of those drafts, and then over the next few months, you can expect to see much more on this as well. So unless there are any questions on this, I'd love to move into some of the specifics on the parent family access.
Great.
Excellent. So I'm going to start with an update on our parent fee with the comment that in June, at the June board meeting, we will ask for a final vote on the parent fee. I know we voted to put in public comment to implement it, and we'll come back and vote formally. We have not received more robust public comment than what you got as a summary last time, and you have here a summary of this the fee scale and the dates that we have had hearings and had public comment. Again, the public comment was consistent with what we heard at the beginning of the process. Have had no more since the last time we talked about this. That is really about some of the larger families, and knowing that that is a challenge, that a compromise we had to make, and really did analysis to ensure that we were minimizing the impact on families as much as possible, but also a lot of real appreciation for the innovation that we are offering and the relief that this will provide for parents. So we have 1 week of, 28th. So we have 2 weeks of public comment left, which we invite people to provide additional feedback if they have it. As I said, given where we are, we don't anticipate having any dramatic changes to the structure, but we'll ask for a final vote on the parent fee chart next meeting to be able to fully implement it over the as we head into the summer. So that will still, we are working on technology, an online calculator, communications, and policies that need to be adjusted based on this, particularly given some of the subsidy policy adjustments we made over COVID, and knowing that that was accompanied by a waiving of our parent fee charges to parents. And now, as we get back into charging, wanting to address some of the changes that will require. So we're thoughtfully going through that, and we'll have more information on that for you in June, but wanted to provide this update, announce the last couple of weeks of public comment, and as we head into a conversation over the next hour of the subsidy regulations and subsidy structures overall, wanted to highlight the progress we'll be making and have been making on this.
That's great.
Excellent. So let's start. Sorry, go ahead. Unless there are any questions on this, I would love to introduce Aradhana, who is who we will, I'm going to introduce a little bit and then I will let her go over to her slides. So as you remember, as we, prior to the pandemic in the fall, some of the challenges we've had in projecting caseload analysis and using trends in our caseload to really accurately look at what we can expect in terms of enrollment over time. And so as we knew, one of the challenges we have is the technology does not look at trends. We can capture point in time data, but for 55,000 data points, that can become quite difficult to look at over time. So we began to invest in an infrastructure, a data infrastructure that would help us look at caseload trends over time, make better projections, and really understand it's not simply a point in time enrollment that determines our budget, but things like churn in the system, things like how likely can you expect an infant and toddler subsidy to be replaced by an infant and toddler if they do leave the subsidy system versus a school age, which would have a different cost. So understanding how we maximize that caseload budget that EEC is appropriated, and also then what we do to try to set some goals for our subsidy system that will help us make sure we're holding ourselves accountable to continuous quality improvement for that, for both process and outcomes around access aligned with the strategic plan. So we were lucky enough to partner with 3SI, who is based in Seattle, but works with many jurisdictions, states and local and municipalities nationally on looking at data analysis in the early childhood and childcare arenas. And so I will, in full disclosure, say that we are partially done with this analysis and that we've gotten to a good interim spot where it made sense to come and have a conversation about this. But there is a lot of analysis left to do and a lot of infrastructure left to build that will help us make sure we're really maximizing this. So with that, I will hand it over to Aradhana and let her go through the analysis that 3SI has supported us with to date, and then happy to take questions and thoughts as we move forward.
I just want to add that, or at least underscore perhaps, that as I think about the future system, this to me is really one of the single greatest levers to pull, right? To figure out this subsidy piece and this access and equity. I mean, if you look at the data nationally or state-wise, we're just not at all where we want to be.
And I think just, sorry, I'll say one more thing, that in conjunction with that, Charlotte, so is the fact that we are making a very different kind of investment in our programs through the federal funding we've received. Yeah. It's an opportunity to step back and understand our subsidy system as providing that access for families and really understand the dynamics there. And so want to take advantage of that moment in time as much as possible and set realistic, but ambitious goals for the system as we progress.
And to think of it less as one subsidy at a time and a system that, brings public dollars into what is a privately funded system. Anyway, it's a longer conversation, but this is great. I'm so glad you're thinking that way.
Now we really will hand it over to you.
Welcome.
Thank you, Commissioner. Thank you, everyone. Good afternoon. My name is Aradhana Roy, and I'm representing 3SI. So in the next slide, we can take a quick look at what we are seeking to do with EEC and what we have accomplished so far. As Sam said, we're very much still in process with our analysis, but we do have some interesting findings that we are able to report. So in the first phase of our project, what did we start out to do? We wanted to look at the state population data, meaning census data, and EEC's own extensive internal subsidy data, and bring them together to try to estimate the current gaps in utilization of subsidies or subsidy-based financial assistance among children aged 0 to 12 across the whole state. And we looked at a period of about 26 months, starting January 2019 to February 2021. And we wanted to understand, all right, first of all, the big question is, out of all the children aged 0 to 12 in Massachusetts, how many, based on income and employment, are actually eligible for subsidy based on current guidelines? Of these, how many are we serving today? And how has the caseload for subsidies trended over this past period? So the first part of our analysis was to examine the gap in utilization. The second part was to focus on the population of children that are actually served and to figure out that in this 26-month period, how have subsidies, how has the number of children served trended based on key dimensions like region, where these children are, how old they are, what type of subsidy, what funding agency are they receiving subsidy from, what is their rates, what type of programs do they attend. So we try to understand where have subsidies grown, where have they declined, and what does the shape of that graph look like for this 26-month period. And based on these two parts of the analysis, we hoped to generate insights that could help EEC with their policy planning. So what have we found so far? The observations we have, as you know, has been discussed so much now, there are two distinct sub-periods. In the period that we examined in this 26-month window, there's the pre-COVID period, and then there's there are trends since COVID. So pre-COVID, what we saw was that subsidy growth in the state in the period from January 2019 through about June 2020 was largely flat, mostly stagnant. And June 2019, as it turns out, was when subsidies hit their peak utilization. They were at their heights. In June 2019, subsidies served roughly 59,000 children in the state. 59,000 children represented only a small share of children who were actually eligible for subsidy, not just low-income children, but children who were actually eligible for subsidy. These 59,000 children represented, in June 2019, represented about 12% of children eligible for subsidy. The other 88% were not served by subsidy in June 2019. Then we have the period since COVID. As we all know, subsidies have declined significantly across the state, utilization of subsidies. And the last month that we examined in our analysis was February of 2021, which is just a couple months ago. And in February 2021, we found that the share of eligible children served by subsidy has declined even further, so that now in February, there were roughly 43,000 children served by subsidy. And that accounted for 9% of children eligible for subsidy in the state in that time period. So, any questions so far? We can move to the next slide and talk a little bit more in detail about what the trends have been. So the first set of trends I'm going to share with you are how the number of children served by subsidy, how have they trended by age group. So 4 age groups: infant, toddlers, preschoolers, and school-age children. Now, as you know, school-age children, school-age subsidies account for about 60% of total subsidies in any given month. And what we see, the graph on the lower right-hand corner will show you. So starting January 2019 up to February 2021, what do we see? In this entire 26-month period, school-age subsidies have declined by 19%. Preschool subsidies also declined by 19%, and the percentage decline in the toddler and infant categories has been even greater. So what does that mean for school-age children? For school-age children, that means that a 19% decline since January 2019 means 4,700 fewer children served by subsidies in February 2021 compared to January 2019. Now, the volume of infant subsidies that are given out is much lower compared to school-age subsidies. But if you look at the percentage decline, what we have lost in terms of subsidy utilization since January 2019 is 45% of this total money. So the table on the lower right-hand corner will show you, so in this 26-month period, we have some key milestone dates. There is, our starting period, which is January 2019, then the end of that fiscal year, the end of fiscal year 2020, and then the year-to-date fiscal year 2021.
Aradhana, can I just interrupt for a second and weigh in here? One thing that I know we've been talking about as we've looked at this over the last few months, obviously FY21 was, given the fact that we sort of paused enrollment in March through the closure and continued to pay for enrolled children through the closure, and then re-upped in the summer and recalibrated. So you see that FY21 is really that COVID period, and is certainly, as we have been talking about over the course of the pandemic, we at EEC have done everything in our possible in our subsidy policies to try to prevent this kind of drop in enrollment. But the drop in enrollment is that you see in FY21 is driven by things far more dramatic than policy, right? We had a pandemic going on, and I want to just point out, particularly on the infant and toddler, I think Massachusetts is unique on some of the pre-COVID distribution of subsidies in terms of infant and toddler, but certainly the country right now is seeing a lower utilization in that infant space in particular from other states and what we're hearing. So just to contextualize some of this, some of the challenges we've seen here, and certainly the school age and preschool are numbers we've been looking at over the last few months and watching to see what we could, as a board, to be able to see what we could do to address these. So I just wanted to contextualize some of this in what we've been talking about and what we're seeing at a national level too.
Great, thank you.
One thing I actually, just picking up on that, wanted to ask about is you've got January 2019 and June 2019, and then it jumps to June 2020. What happens if you draw a line at January 2020 or February 2020? Is, it looks, you could say it's trending downwards, January to June. And then of course, this natural shock to the system. Yeah. So, yeah. But I assume you looked at that.
Yes, right. And that's exactly right. So if we look at, for example, so we're starting in January 2019. If you look at the rest of that fiscal year, ending in June 2019, we see, mostly look at preschool, toddlers, and infants. Largely flat. However, school aid subsidies do have a cyclical pattern. Mm-hmm. They trend upwards as we head into the summer, mm-hmm. and then they trend back down as the summer is over and school starts again. So we see that cyclical pattern, which is, the school aid subsidies go up until June, and then they start to go back down as the fall rolls in. And now let's look at the central part of the graph, fiscal year 2020, just that fiscal year. We see, what do we see? Again, we see that cyclicality clear in the school aid subsidies. What we see for preschoolers is, there's a slight upward increase in the first quarter of fiscal year 2020. But other than that, the graph is largely flat. And the same thing we see the same thing for toddlers. There is an increase. There is an increase going into September. But then, around the November-December period is when it hits its peak, even though it's not very pronounced, and then it starts to trend downwards again. And we see roughly the same shape for infant graphs as well. So we have monthly data for this entire period, of course. And if there are, particular months, for example, that we're interested in, we want to know, school aid subsidies follow the school year. But we want to know what specific trends seem to, if there are any policy effects or other effects that seem to be driving infant and toddler subsidies, which are less governed by school year dates. We're happy to provide that or provide more in-depth sort of analyses monthly for that.
Thank you.
Move on, should we? Okay, great. In the next slide, we will look at the same data through another lens. We will look at a regional analysis. So here we have the 6 subsidy regions and the same time period examined monthly. Now, what are we seeing? Out of the, so just as a, as you know, probably, the largest regions in terms of number of children served are Northeast Mass and Southeastern Cape. The smallest region is Central Massachusetts. Now, over this 26-month period, the shape overall, I'm focusing on the graph over here. So over the 26-month period, you can see that roughly all the graphs are shaped the same, in the sense that they increase slightly in the latter half of fiscal year 2019, stay mostly flat through fiscal year 20, and then, as Sam said, they decline sharply with the onset of fiscal year 2021. So the percentage decreases over this entire 26-month period are listed on the graph, but we can see that Metro Boston and the metro regions are the ones that saw the greatest percentage decline in this entire 26-month period. And if we were to look at only the period that was COVID impacted, meaning starting June of 2020 through now, through February 2021, the periods, the regions that showed the greatest decline were also Metro Boston and Metro. Well, what else? In this graph in general, so what we see, the smallest, I guess it's worth highlighting, the smallest decline over this entire period in terms of percentages was in Central Mass, 11% only. Any questions?
Well, Aradhana, just I would point out, I think just again, harkening back to the conversations we've been having as a board over the course of the year of looking at where we've seen some of the densest COVID cases over the course of the year, and seeing that in relation to our subsidy utilization is stark here. I think, we've been looking at the CCR and R's capacity, voucher capacity over the course of the pandemic too. And you can see that this is not an issue of capacity of our subsidy system. This is really, particularly the FY21 data here is really about utilization, is people not opting to utilize, not that we were turning people away. And you can see that, I think, particularly when we look at where some of the overlap between the COVID risk and the subsidy utilization certainly makes that stark.
Yeah.
So I just had a question about this, given the fact that there was sort of a one-time occurrence with COVID and the pandemic during this period. Is it reasonable to draw implications for the future, or this analysis? What are we using this analysis for? Because it really is following a system of trends that may not replicate itself. Do you think?
Well, I don't think we're looking at this as trends to say, what would happen in the future, but it tells us a couple things. One, our peak enrollment for subsidies was June 2019.
Right.
And so it does give us a trend pre-COVID to be able to understand what that enrollment looked like and where and how we saw those peaks and valleys. I think from what we look at in the FY21 data is a starting place. I mean, this is where we are today. This this is what has happened over the last few months to be able to, or the last year to be able to get us to where we are today. And I think most importantly, coming really starkly in with as we see uptick in some of our utilization, as you see in this month's caseload, where and how is that playing out, and how does that compare to pre-COVID levels? We are pretty clear that, the country is pretty clear, and every state is grappling with this, with fluctuations in subsidized enrollment. Many times it changes by states, by COVID risk, by their funding structures, by their subsidy policies and access, and a lot of that will drive these trends in state by state. But I think every state is pretty clear that work is going to look different in the future, and that families are going to have different needs. And so understanding a benchmark of what has happened over the last year and how we start to calibrate the new family needs based on these last year trends, I think will be continue to be really informative for us as we look at what kinds of adjustments we need to make in the system to be able to account for that change.
Yeah, I mean, the sort of flexibility, fluidity piece is not going to go away, right? I mean, that was a signal already, right? That's part of June 2019. Yeah. Commissioner, can you just confirm this pattern for Massachusetts, even if you said pre-pandemic, is a pattern nationally, like other states also grappling with this, or what would you say to that effect?
Yeah, I think that the pre-pandemic, I will say, varies dramatically state by state as to what the trends were. And a couple of compounding factors are subsidy policies and priorities, which drive access for specific populations, ages, differentiation in rates between infant, toddler, preschool, school age. Those kind of policies really do drive some of the pre-COVID trends. And many states, I mean, in Massachusetts, most of the state investment has built on federal investment in subsidized childcare for EEC. And many states have opted to complement state investment in different ways, which will also drive this kind of trend of enrollment and subsidies as well.
And it's been a very long time since we looked closely at our subsidy system. One could put a frame on this just to suggest maybe it hasn't kept pace with the needs, and maybe it's not the fit that we'd be looking for going forward.
And I think this is exactly the question we wanted to bring out today. Aradhana, if you want to go to the last slide around the different the caseload eligibility, and I think then we can launch this conversation into exactly, Chair Lissow, what you were alluding to of what do we want to do with this information.
Thank you.
Excellent. Sure. So the last lens that we use to examine subsidy caseloads is by funding agency. So here they are, and as we know, and as the group knows, so income eligible subsidies account for the largest share of total subsidies utilized in Massachusetts. Then there's DCF and DTA at roughly similar percentage breakdown. What has happened in the last 26 months? Again, we try to, as was pointed out, we view the impact of COVID as a discontinuous change, as a disruption. And then we look at two periods. First, we look at the period from Jan 2019 through June 2020. What happened? So what we see is that DTA and DCF subsidies grew slightly in the period from January 2019 to the end of fiscal year 2020. Income eligible subsidies have been on a declining trend. There was a slight uptick in the summer, June 2019, as Sam pointed out, when subsidies hit their maximum. And then ever since then, although there have been fluctuations, the trend overall in income eligible subsidies has been a declining one. Since June 2020, we are looking at a completely different shape of the graph. Income eligible subsidies declined sharply by in the 8 months since June 2020, and so have DCA subsidies. DCF subsidies have remained much flatter than subsidies from these other two agencies. So there are, I'm sure, policy and programmatic explanations for that, but this is where this is, as Sam said, this is where we are today. Any questions with respect to this view of the analysis?
And I know that the board knows this, but I think first something might be worth saying out loud is that because DCF and DTA are entitlements and that any family that qualifies under they're automatically enrolled, that fluctuation in the income eligible is where our policies are much more targeted to address.
Yeah, this isn't a question, it's just sort of a reflection. I think that, as we look to the future and thinking about ways to increase, the number of families that are served, because I think that we can all look at the number of folks that are being served now, 9%, and agree that that's not where we want to be as a system, and that we really want to be prioritizing access for those little ones who need it the most. Looking at the complexity for families of accessing these supports, I can say from the families that I work with that oftentimes families are overwhelmed by the complexity of applying for childcare subsidies. And it oftentimes takes them having a master's level social worker, plus sometimes somebody with a law degree working with GBLS or a place like that, in order to access the subsidies that they're in fact eligible for. And so I think that as we look to ways to increase these numbers, especially seeing how the income eligible numbers have decreased, I think that that's definitely something that we should be thinking about as simplifying things for families that we serve.
Yeah, thank you for that comment. And I think is hopefully some of the conversation, you teed up the conversation, I think, of trying to delve deeper into what areas could and should we prioritize and simplifying in terms of ensuring that families can access this subsidy, and again, setting priorities and making sure we're holding ourselves accountable to those.
Can I ask just a couple of technical questions? Have you looked at, or I assume these numbers don't include students who are enrolled in public preschool programs or Head Start? Is that?
That is correct.
Right.
So these are children served by subsidy.
Head Start, it does, because most of those are accounted for in our existing numbers. So sorry about that. So
they're within the 43 or the sort of top line numbers of income eligible?
Right, Sam, should I answer the data question there? So the 43,000 children served as of February 2021 include children served by all agencies. So that's one. So income eligible and DTA and DCF. And okay, as the commissioner pointed out, yes, explicitly these are simply subsidy caseload numbers. However, the fact is that because of the nature of the other programs that you pointed out, Head Start, Early Head Start, and because of the braiding and blending of funds, subsidy funds with these other programs, these numbers do include at least some portion of children served by other programs.
Got it. And when you did the analysis of the eligibility, how did you do that? Other than obviously you have some income data that we have, but how did you do that in terms of the other eligibility criteria?
So we used two eligibility criteria. We used income and employment, the service need as it's called. So what we did was we looked at the census data, and as you know, it is at personal level and household level. We took the full population of children from 0 to 12 years for the whole state and stratified it based on the census data on income, meaning from what percentage of established the state median income, and then how many below, how many above, and then we had percentiles for the income. So we had a whole schedule of income categories. We also looked at household employment data from the census data, and looked at census data will tell you how many adults in the household are employed. How many, so for every child, then we looked at, we estimated the count of children for whom both parents were employed, meaning filling the service need criteria. So in order to be eligible for subsidy, we calculated, when we estimated the full count of children eligible for subsidy in the state, we made sure that they fulfilled two criteria. Their household income should be less than 85% of the state median, and both parents employed, meaning fulfilling the subsidy.
So,
And were you able to update that for the post-COVID period, or?
Oh goodness, yeah. So
Okay.
we are in process of doing that. So as you know, that the most recent census data we have available is from the end of 2018. So we had to do some, so we have to use that data and then keep updating it based on sort of proportions that we see across the state for shares of children, how many children age out, how many age in. What it doesn't do, that data, is to give us accurate current estimates of, for example, unemployment. So our next step, and a crucial step, is to start looking at the labor market information from Massachusetts and start looking at, as granular as we can get, start looking at unemployment rates that are updated every 2 weeks. And apply them not just by region, but by industry. So to try to be as comprehensive as we possibly can in applying these current unemployment rates. So to answer your question, in a sense, the numbers that we're seeing, meaning the fact that only 9% of eligible children are served by subsidy, is a conservative one. Because since then, lots of, the unemployment landscape in the state has changed. The median income landscape in the state has changed. So once the next census data will be available to us in the fall of this year, and that will be the most current. So in the interim, we will continue to take data from BLS and other state level unemployment sources, and I'll keep updating it for unemployment.
So Aradhana, I think Secretary, just to put a fine point on it, it doesn't include, so as Aradhana says, the data includes income and employment as of the last data point we could reliably get into the system. So that's one thing. The two things that are important to note on there is it doesn't include other eligibility to subsidy, like disability status, things like that, which may trigger. We did not push on that given the available data with 3SI. And then obviously unemployment has gone up, incomes have gone down. It's very hard to tell. So there's definitely fluctuations in this that are not accounted for.
Okay, great. Thanks. Sorry for that weedy question, but thanks for the answer.
It's good. Good weedy questions are good.
Joan, go ahead and jump in.
Hi, thank you so much, Aradhana. This is really great to be able to look at. I think it gives us some really important tools as we look ahead. Part of how I'd love to see us use some of this is to begin to benchmark in tangible ways recovery, and then also meaningful progress beyond recovery. And I think part of what it enables us to do in such a powerful way, and that we've started to touch on, is to understand the ways in which some of these trends are impacted by things far beyond the sort of contained EEC system, right? Things like COVID, things like patterns of COVID, things like changes in the labor market, but also, I think it also gives us the opportunity to be much more highly attuned to the impacts of key policy decisions. What does it mean to open up eligibility in one of these lines, and what does that do within the system, right? So if we're seeing, for example, an uptick in eligibility for DTA, might that have a downward trend on IE? And then what do we do about it, right? So I think we started pointing to, strategies for helping to improve access as one area, but there are many. And so I think this is going to be really, really helpful as we look ahead. I just so appreciate the commissioner, the team, and 3SI's work on this. I think this is going to be a powerful tool looking ahead.
Thank you.
Excited about it. And I think, Joan, I just had the benchmarking, I think, was a really hard data point to start to get. So having this will be so helpful to be able to, I mean, you all remember going through the strategic plan and trying to set, priority populations and not really being able to reliably start to say, where is our starting point to where we're getting across the board. And so really excited to have this to, again, I mean, I say accountability in the most positive way possible, but to have some systems accountability of is it working as we make changes and investments.
Right.
Unless there's any more burning questions, I'd love to pivot to this exactly where I think you all were going. Is it where and how and what are some of the paths ahead? I think just looking at the time, we have a list here of the things that 3SI will continue to work on, and very excited to have them back throughout the year to be able to continue having these conversations as we make different discoveries in the data. So yeah, thank you so much, Aradhana, for being here and for going over some of the work.
Thank you.
So I wanted to spend the next few minutes really making sure that we kind of set up for what are we trying to accomplish here. We talked about our parent fee scale and chart, which has been a really important work for the department to set us up for looking at and analyzing and engaging with that subsidy conversation. And I think to Nikki and Joan's point is that this is not just merely a question of if you build it, they will come. You have to build it correctly so that they can access it. And I think that's part of our work ahead, is understanding where those barriers are and where we need to think about the process ahead. And so if we go to the next slide and moving into the subsidy policy questions. So we tried to capture here, and there is some additional information throughout the deck that we'll encourage everyone to read closely. But the really trying to understand both in expanding access, what our goals were for some of this, of really thinking about addressing the problems of access to tuition subsidy, knowing that the expense of childcare for all families can be overwhelming, and particularly as we look at as Nikki was saying, that expense and the complication of getting the tuition relief when low-income families are needing that. How do we really thinking about access to that? But then also really looking at those target populations and understanding how we target the gap between the percentage we're serving and the percentage we will continue to refine who could have eligibility. But I think not the least of which, and I will say from my perspective coming into Massachusetts, having not a robust experience with the operational processes, also knowing and hearing and spending time with providers where the bureaucracy might be getting in the way of our ability to provide that access and address that gap. And so as we look ahead, that we are proposing a number of different, 3 different components of the work, of certainly looking at setting targets for population, setting priorities, and making sure that our policies allow for those priorities to be successfully reached. But then also really looking at how do we create a subsidy system and where you have providers who are willing and able to take subsidy as a way to expand access for families. If only 50% of our providers are even accepting subsidized tuition, that is a percentage of that is completely out of access to some of our families. And I know I have heard from providers, and I'm sure many of you in many different ways have heard from providers the desire to engage in the subsidy system, but some complicated factors that are very contextual that prevent them from doing so. And we know from looking at the data we've been looking at over the last year is that there are only about 130 or so providers that accept enough subsidies to be able to sustain themselves. 130 center-based providers and many more family childcare, but that have able to sustain themselves on subsidies alone. And so really looking at our subsidy system, not just as a program financing, but really as how we address that access gap through that. And I think all wrapped up in the operational challenges that we have and wanting to address those. I think that the question of that is not only to achieve the first two goals, so our priority populations have easier access and more providers that will accept that tuition subsidy, but also because it is very expensive to administer, the more complications we put on. We need to hire more external people to help us manage. We need to do much more oversight of the policy. So really understanding the dynamic around that, where simplification will achieve our goals and also achieve our goals of reducing barriers for families, and also to the earlier points around department investments and department structures, really maximize and be thoughtful about what functions we need to play and what functions we need to outsource. So moving on to the next slide. When we've looked at this, we did start to categorize some of the current pain points that we've heard through our engagement. As you remember from the last few meetings, in addition to the data analysis, we've also been doing robust qualitative analysis in a way that we can really understand what are those pain points that people are experiencing. And so we've captured some of them here, and I won't go through them for the sake of time. I won't go through them one by one, but I wanted to categorize a few of them and then really spend a little bit more time on some of the strategies we're starting to engage in to address those, and looking to get some feedback on that and the process we'll do to look at that. Really looking at eligibility, adding flexibility to eligibility requirements is a huge area of concern for us. And you see both in understanding with rigid eligibility requirements, one of the challenges you have is certainly access for priority families, but you also see a lot of other questions in those pain points around requiring more administrative oversight, more documentation from families, needing more time-sensitive materials, and really thinking about where we are leveraging engagement that low-income families may have with other systems, so as not to be solely reliant on the childcare eligibility as the way to determine access to childcare tuition. I think in addition, what's also wrapped up in some of here is that the structure that we have around contracts and vouchers and understanding some of the complicated nature of how people can braid together our own systems to be able to make sure families have access also adds a level of complication. And so what we're really looking to do is really thinking about looking at verification options, certainly eligibility options. I want to be clear, we maximize federal eligibility at 85% state median income. So this isn't necessarily a question of finding more flexibility in the federal regulations or the federal or in our overall structure. There's certainly places where we can find things like categorical eligibility, but I think a lot of what we're going to look at is much more process oriented. And Nikki, as you pointed out, that it is being able to make sure that we are streamlining, that we are eliminating as many barriers for families and for our providers and for our resources that support families as possible, and understanding then how you can look at key populations and start to address outreach, support, engagement, all of the strategies we know actually help families get into the system without needing, as Nikki so aptly pointed out, a master's level social worker to help navigate that we can further disperse our resources to support families by making it easier and less and needing less expertise to help navigate that. So that I think that, and I will just quickly go to the next slide and highlight the ways to do that, and then we'll open it up for questions and thoughts. So this is multifaceted. Certainly our regulations are a starting point. And as we talked about with licensing and educators, they are the floor, they are the structure, the framework in which we build from. But from there are the policy guidance, the processes, the protocols. So it's one thing to say 85% state median income. It's another thing to say how you demonstrate that income, what documentations are allowable, all of those questions. And so looking at both the regulations and the policy and guidance together is an important component here to find as many options as possible to make sure that we aren't creating barriers. But then we see a number of other things there, right? We also have a number of limitations in our IT systems. Our policies are things like parent fee, for example, is hard-coded into our technology system. And so it makes it time-consuming and multifaceted to change those things in an IT system. So being thoughtful over the course of the year about how we restructure so that not only are we making it easier on paper, but we're making it easier on practice by really making sure that that technology supports that streamlining. Not the least of which is Kinderwait and our wait list and the integration between our technology systems that need to make sure that we are both making it easier to access the slots and administer the subsidies, but also to make sure you know where and how you might be in process as we set priorities and try to meet them and be able to manage that well within a wait list and within the population as a whole. I think ultimately that integration, the first part is really thinking about the efficiency and the technology that we know we need to look at. But I think ultimately if what we want is to understand that children who are in certain settings getting certain quality of programming are achieving certain goals, we need all of our technology to be able to talk together. And EOE has been supporting has been driving some of the longitudinal data analysis and integration across data across systems. And there's some real-time practical support I think we can start to build into our own systems for providers to give that in, while we look at the macro benchmarks we should be hitting as a Commonwealth, how can we provide the localized data to be able to make sure that they're able to see who's in which classroom and be able to assess that real time while we look at our macro progress towards our goals. And with that, I think one of the other things that will look at when we are able to streamline, when we are able to look at what functions EEC needs to enhance, that will then require us, not the least of which require us because procurement wise, we are outdated as any provider with a contract will tell you, but to look at what functions need to be put into those contracts and rebid. And so you have over the next slide, I will just hit on that and then stop talking and hear what your reactions. But really to look at that there are 3 contracted services that we put out there that are part of this subsidized system. We have those providers that are contracted directly with us to serve subsidized children in for slots within a contract. We have the childcare resource and referral agencies that manage our vouchers and the individualized family access. And then we have the family childcare systems that serve as contracted providers for our family childcare, who individually be very difficult to hold a contract, but with a system, they're able to manage that eligibility and verification and much more efficiently. We are in the middle of trying to understand all 3 of these components. And as you know, over the course of the year, have looked at CCR&R rates and numbers. We've looked at family childcare systems and the role of professional development development they can play, as well as trying to find the best supports for our contracted providers, and where our contracts nationally, I know we have conversations at least with one state a week about where our contracts could be leveraged and where they're looking at saying, how do you really make sure contracts are leveraged to provide comprehensive services to vulnerable populations, and with the flexibility that's needed to serve, for example, a center with a density of homeless families that may need much more specialized services to be able to help reach self-sustainability and over their course of their early childhood education in different ways than a family who only needs 9 to 3 care. And so really being able to respect that in their contracted services so that we're really targeting the services families need with the resources we're providing, as opposed to hoping that families can meet families can retrofit their needs to meet our services. So with that, I just wanted to highlight that those are 3 components that make up our system that we will be addressing over the course of the year. Our full intention is to rebid those over the course of FY22, but wanted to address, as you think about this, the goals, the supports, and the ways we're thinking about those pain points and priorities with the board prior to digging too deeply into it, or as we start to dig deeply into it over the next few months. Thoughts, reactions?
Joan, do you have your hand up?
Yes, thank you. Commissioner, I think everything that you just described is spot on. One of the things that strikes me is that in addition to maximizing the federal flexibilities and to sort of revisiting ways to reduce bureaucratic hurdles from a lot of sort of inherited systems and policies that have been around for a long, long time, and thinking in a fresh way about IT and overall improved processes, I don't want that focus to detract from the fact that ultimately, I think for us to get where this system needs to go, both in terms of recovery and expanded access, we're going to need state funds with which we have greater flexibility to meet the needs of children and families than we will ever have with federal funds. And so I want to keep that as part of the conversation, because I think if we're only focused on process improvements and maximizing federal dollars, we're going to miss that sort of linchpin funding that will make the difference between a system that really can function well for kids and families across the Commonwealth and something that continues to struggle to do that job. Yep. So I just want to make sure that that's part of the conversation as well.
Yeah, and I appreciate that a lot, Joan. And I think that one of the things we are, as Charlie so pointed out at the beginning, is in this unprecedented point in time where we're able to talk about the subsidy system while we're also supporting operational dollars to providers, so that we can talk, I think, honestly, about the tension we have in the system of program financing and family access. We are, as you have all pointed out, in various ways, we are a private market operating as a public good. And so how do we grapple with the funding we have to achieve both of those goals, to stabilize and sustain the services we need? And so I couldn't agree more. And I think not only do we have to think about that, but I think we have an opportunity to think about it in collaboration with what the board set forth as a priority around alternative approaches to financing as well, that will couple and teach us a lot of lessons, and hopefully continue to work with the Economic Review Commission to be able to understand how those lessons might translate into long-term vision and policy and supports.
Mm-hmm. Nikki, go ahead.
Thanks. I just want to commend you for the work that's been done, Commissioner, and everybody at DC, both in terms of the quantitative data that was shared earlier and the qualitative pain points and things like that you've shared. I think that they're spot on and align well with what we see working directly with low-income families. So thank you for taking the time to understand that. And I think it provides us with a really good basis to think really critically in the months to come about how to address these issues. So I just want to say, I know that that's part of understanding how we're going to move forward is understanding where we are now. And so I commend the department for just all of the work that's gone into this. I do want to just highlight really fast one issue that was in the pain points and that I have belabored in previous meetings as well, which is just wait lists. And I just think that we can't stress enough that if, there's no reason to have a wait list if there is capacity in the system, which we know that there is. Why are families waiting on wait lists? Why are they waiting so long? And continuing to kind of get to the bottom of that question is really, I think, important for the families that we serve, because it's not just simplifying things at the point of entry, but it's making sure that throughout the process, they're moving through it quickly, because otherwise what ends up happening is families lose job opportunities. And that's a really big deal for the low-income families that we're most trying to help. So just wanted to kind of raise that up one more time as we're having this conversation. But again,
I completely appreciate that, and I appreciate bringing it up. And right before COVID, I think I was telling you that right before COVID was, I was driving around the state visiting people, and anyone who would sit down and say, okay, show me how this wait list works. And obviously lots of challenges that are preventing us from having the kind of seamless experience we want for families, and providers from really being able to spend their time supporting families and children, and less trying to navigate technology and bureaucracy. And so I can't say I have any solutions on that one specifically at this point, but very well taken. And I think, a very high priority for us to try to figure out how we can really reform the waitlist process without losing those families who've been waiting on it along the way.
Thank you.
Thank you.
Joni.
Ditto with Nikki's comments. I think we're all shaking our heads here in agreement. I think this is a huge challenge, but I think given where we're at, this is also an opportunity to kind of sit back and, whether we rebid, redo, rethink, think whatever we come up with for working with our most vulnerable families might also be used to look at that whole picture of working with all families. And I would like to take this opportunity to really look at the entire universe and say what's working for one might work for another or not, and what do we as a department need to do to move everyone forward. So I think this inflection point is good.
No, and I think, Joey, that is one of the hopes, I think, as we think about rebidding parts of our system, is how can those parts of the system move, again, spend more time minimizing in our policies the bureaucratic oversight, the bureaucratic processes, and really, I think, having those providers, whether they be CCRNRs, CFCEs, family child care systems, be able to really be present for all families and help them navigate the system, again, without needing a PhD, but really help navigate the system, because we know that it's not only low-income families that are vulnerable. It's not only and not only vulnerable families need support. And so how do we really make sure that those supports are transparent, and that our contracted resources are able to help certainly get you into a tuition subsidy if needed, but also help if you aren't, or if it isn't appropriate or whatever, help be able to find those other community resources. And I think this is just hearkening back to our first conversation of this board meeting. Really, I think what we're also hoping to learn from what kinds of supports in communities can really help play that role as well.
Perfect. Thank you. Thanks.
And let's just acknowledge full circle. Part of effective reopening and stabilizing and moving the state and the nation ahead is actually to support women who have taken the hardest hit in COVID, both in terms of job loss, but also job loss as a function of loss of childcare. So again, I couldn't agree more. And yes, to the vulnerable populations, also understanding that demographic hit is right across the income levels.
Mm-hmm. Mm-hmm.
And it's always been a pain point, right? We had not figured it out pre-pandemic, but here we are.
That's right.
And we know that childcare expenses make families sometimes very vulnerable if we aren't careful. And so really being able to make sure we're preventing that as well with that.
Yeah. So I'm mindful of the time, and I'm just thinking, it seems, Commissioner, like we could roll up the final agenda item into the June meeting. We may even be able to kind of think about a memo or something ahead of June's meeting. But
I can actually think you have all the caseload data and all the data there. And so I don't know, we can reflect on in June what the year looks like. I will just highlight, you have a summary of it. I will just highlight that we are starting to see some of our caseload stabilize as we got the March numbers. And so, just wanted to highlight, we are certainly not back at a place where we are fully enrolled, but we are seeing some shifts in that are worthy paying attention to. And so of all of the information in that next agenda item, I think that's the most important bullet point. So I will leave it at that, and happy to answer any questions offline or at the next meeting.
that's great. Well, with that, we will close the meeting. Let me underscore, the use of data just continues to drive the kinds of conversations that we need to have at the board, right? Whether it's data that's about grant applications and uptake all the way through to this modeling of the subsidies. It's just great. Really appreciate the data-driven conversations. It's in a month.
Thank you so much.
Meeting
Thank you.
adjourned. Thanks, everybody.
Thank you.